It's amazing what plastic surgeons can do these days. They can take fat from where you don't want it and put it someplace else to make you look a whole lot better. Well, joining me now is Dr. Elie Levine. He's our plastic surgeon, and Dr. Jody Levine, our dermatologist, who also does fat transfers, right? Good to see you guys.
Good to see you too.
All right, so we're talking about fat transfers. So talk to me about the process of what it is. Like, people think, you know, they take all this fat from around my belly or my butt. What's it really like?
So taking fat, if it's handled in a very delicate way and brought out of the body very delicately, can be placed back somewhere else in the body and help volumize. And it can be used in multiple different locations. And as long as it's dealt with properly, it's a great way to permanently volumize other areas.
In other words, basically fill in places that need a little filling, which is something you do, Jody, right? Particularly in the face. So who would be a candidate for something like this?
Well, volume is youth. So as we age, our face gets drawn, and if we add volume, you look younger. And basically, many people have donor sites for fat transfer.
Lots of places to get fat from.
Lots of places, the stomach, the flank, the lower back. There definitely are those people who are so thin that they can't use fat, but the majority of people can.
Yeah, we can always find some somewhere. All right, so we have some before and afters for the face. I want to throw those up and take a look at them right now. Here you go. I mean, this is dramatic. I mean, look at that. Tell me about that, Elie.
Yes, so this is someone who is over the age of 50, thin, takes care of themselves, and because of that, their cheeks are a little more drawn, their nasolabial folds, we call them, the marionette lines, the lines near the mouth, they're all looking drawn. And by adding volume, she looks so much younger and so much fresher.
Right, and is that one treatment, or is that sometimes multiple treatments?
That's one treatment.
One treatment, okay, and it lasts, like you're saying,
it lasts.
Long term.
It's a natural filler,
right,
and it lasts.
Right, all right, another thing you do is the buttocks.
Correct.
Well, right, so most people want to take fat out of their buttocks, but some people want to put fat on their buttocks. Explain that.
Right, so it's variable. There's some people that feel like they don't have any body shape and they want to create more curves. So adding volume to their backside works nicely for that. The term that a lot of people throw out there is a Brazilian butt lift.
Okay.
And what it really does is it just helps give a little more shape. And for some patients, it works really nicely, particularly if you harvest from the flank area, the lower back area. It just accentuates the backside and accentuates the curves.
Right, so basically narrows down the waistline and then makes the buttocks look nicer. It also can improve. This looks a little less bumpy too with your after shot there.
Correct. Yeah. If placed properly, it addresses cellulite as well.
That's beautiful. Okay, now Jody, what you do also, you do hands.
Hands.
A lot of people might think, you know, well, actually they always say the dead giveaway if someone's had a lot of face work done and they're older is to look at their hands. Well, you fix that, don't you?
Yes, the hands, I'd say, is the second most common area that we fill. As we age, you see the veins more prominently, the hands look hollow, and in addition to fixing pigment on the hands, giving volume really rejuvenates the hands. So
it really is the best way to hide all of it, and it's one of the first things you see after the face. You know, you see someone's hands.
Yes.
So it's really impressive. And finally, I want to talk about revision, because a lot of people need things to get fixed. Maybe they had some liposuction and maybe there's some hollowness. Is that basically what you do as well?
So if liposuction is not done properly, you can create contour irregularities, depressions, little divots. And correcting that, I would say, is probably about 20% of my liposuction practice, where this is someone who on their lateral thigh area, they had a divot and we just filled it in to just smooth it out so that it looked more symmetric to the other side and addressed what was a little bit of overdone liposuction in the past.
Well, a much better improvement. It really, I could see the difference there. So I just want to tell you that based on this segment, I'm going to start saving some fat just in case, you know, when I get older and I need to harvest, right? I'll keep you in mind for that. Is that all right?
Sounds great.
All right, I appreciate it, guys. Thanks for coming in.
Take care.